when you suddenly lose your balance and you fall into the ground. Suddenly, every step you make hurts and your muscle isn't in good shape.
Have you experienced an incident like this? What did you feel? It's good that you have an idea that when you damage your muscle, the feeling isn't very nice. Yes, you will experience sprains. Most sprain is a result from sudden twisting that stretches or tears the tissue of the ligaments. Muscles are involved in every movement that we make, and it's practically impossible to rest all of them at once. They are dominant to the way our body works.
Many, if not most, people have probably experienced one of these types of injuries. Maybe you fell from a tree and broke your arm as a kid, took a wrong step and sprained your ankle, or pulled one of your hamstrings muscles during a workout. The skeleton and the muscles that attach to it are what give your body structure and allow it to move. But just like your integral organs, your bones and muscles can be affected by a wide range of injuries and diseases.
Yes, dear learners, the two main systems of the body that bring our movement are the skeletal and muscular system. They are both individual systems but cannot function without each other. The skeletal system comprises of 206 bones, while the muscular system comprises of 600 muscles. For efficient functioning of both systems, other structures such as ligaments, tendons, cartilage, and connective tissue play an important role. Two bones are connected by ligaments, and a bone is connected to a muscle by a tendon. That is why for today, we are going to identify injuries and diseases that can harm the skeletal and muscular systems. Do you want to know more about them? Very good. Then continue listening to our discussion.
Let's start with our first injury and diseases that can harm the skeletal and muscular system. Sprain. A sprain is an injury to a ligament or to the tissue that covers a joint. A sprain is usually extremely painful. The injured part often swells and turns black and then blue. The doctor may prescribe rest, elevation of the injured part, or the application of cold compress or elastic bandage to reduce swelling and speed up recovery. Special types of exercise may also help reduce the swelling and speed up the recovery.
Second is cramps. Muscle cramps have several causes. Some cramps result from overuse of your muscles. This typically occurs while you're exercising. Muscle injuries and dehydration can also trigger cramps. Dehydration is the excessive loss of fluids in the body. Low levels of any of the following minerals that contribute to healthy muscle function may also cause muscle cramps: calcium, potassium, sodium, and magnesium. Low blood supply to your legs and feet can cause cramping on those areas when you exercise. Walk or participate in physical activities. In some cases, a medical condition can cause muscle cramps. These conditions include spinal nerve compression, which can cause muscle cramps in your legs when walking or standing, alcoholism, pregnancy, kidney failure, hypothyroidism, or low thyroid gland function.
Third is fractures. A fracture is a break, usually in a bone. If the broken bone punctures the skin, it is called an open or compound fracture. Fractures commonly happen because of car accident, falls, or sports injuries. Other causes are low bone density and osteoporosis, which causes weakening of the bones. Overuse can cause stress fractures, which are very small cracks in the bone. Symptoms of a fractures are intense pain, Deformity, the limb looks out of place, swelling, bruising, or tenderness around the injury, number, numbness, and tightening problems moving a limb. You need to get a medical care right away for any fracture.
The fourth one is strain. Muscle strain, muscle pull, or even a muscle tear refers to damage to a muscle or its attaching tendons. You can put undue pressures on muscles during the course of normal daily activities, with sudden heavy lifting during sports or while performing work tasks. Muscle damage can be in the form of tearing, part or all, of the muscle fibers and tendons attached to the muscle. The tearing of the muscle can also damage small blood vessels, causing local bleeding or bruising and pain caused by irritation of the nerve endings in the area.
Lastly is osteoporosis. Osteoporosis is a condition of fragile bone with an increased susceptibility to fracture. Osteoporosis weakens bone and increases risk of bones breaking. Bone mass or bone density decreases after 35 years of age, and bone loss occurs more rapidly in women after menopause. Key risk factors for osteoporosis include genetics, lack of exercise, lack of calcium and vitamin D, personal history of fracture as an adult, cigarette smoking, excessive alcohol consumption, history of rheumatoid arthritis, low body weight, and family history of osteoporosis. Patients with osteoporosis have no symptoms until bone fractures occur.
So, to our beloved listeners and followers, did you understand the lesson? I hope you did. So, now, let us have a short review of what we have discussed earlier. What are the injuries and diseases that can harm the skeletal and muscular system? Again, what are the injuries and diseases that can harm the skeletal and muscular system? Very good! We have learned today that there are injuries and diseases that can harm our skeletal and muscular system, and these are the following: sprain, cramps, fractures, strain, and osteoporosis.
Now, to know how much you have learned from our discussion, we are going to have a short quiz. Get your pen and paper and be ready for this short activity. So, are you now ready? Very good! Here is a direction for our activity. Read the questions carefully and identify the causes and diseases or injuries or where it usually occurs. Choose the letter of the correct answer.
Number 1. Which could be the reason of having an osteoporosis? Again, for number 1, which could be the reason of having an osteoporosis? For letter A, disease of the joints. For letter B, vitamin E deficiency. For letter C, decreased density of bones. And for letter D, ligament and joint is twisted. Again, for number 1, which could be the reason of having an osteoporosis? For letter A, disease of the joints. For letter B, vitamin E deficiency. For letter C, decreased density of bones. And for letter D, ligament and joint is twisted.
Number 2. The sprain could injure which part of our body? A. Muscles, B. Tendons, C. Ligaments, D. Bones. Again, for number 2. The sprain could injure which part of our body? A. Muscles, B. Tendons, C. Ligaments, D. Bones.
For number 3, cramps typically occurs while you're exercising, but some cramps can be a result from A. Disease of the joints, B. Overuse of muscles, C. Decreased density of bones, D. Ligament and joint is twisted. Again, for number 3, cramps typically occurs while you're exercising, but some cramps can be a result from A. Disease of the joints, B. Overuse of muscles, C. Decreased density of bones, D. Ligament and joint is twisted.
Number 4. Where fractures do usually happen? A. Muscles, B. Tendons, C. Ligaments, D. Bones. Again, for number 4. Where fractures do usually happen? A. Muscle, B. Tendon, C. Ligament, D. Bone.
And lastly, for number 5, if you have experienced muscle strain, you usually have a damage in. Again, if you experience muscle strain, you usually have a damage in. For letter A, muscle and ligaments. For letter B, ligament and joint. For letter C, density of bones. For letter D, muscles and its attaching tendons. Again, if you experience muscle strain, you usually have a damage in A. Muscle and ligaments, B. Ligament and joint, C. Density of bones, D. Muscles and its attaching tendons. Did you get the correct answer? Good job!
Well, how was the activity? Do you think you managed well? Excellent! Now, let us check your answer. Let us start with number 1. Which could be the reason of having an osteoporosis? The answer for this is letter C. Decreased density of bones, because osteoporosis is a condition of fragile bone with an increased exposure to fracture. The diagnosis of osteoporosis can be suggested by x-rays and confirmed by tests to measure bone density. Treatments of osteoporosis, in addition to the usual prescription for osteoporosis medications, include stopping use of alcohol and cigarettes and assuring adequate exercise, calcium, and vitamin D. Again, the answer for number 1 is letter C, decreased density of bones.
For number 2, the sprain could injure which part of your body? Letter A, muscles, letter B, tendons, letter C, ligaments, and letter D, bones. The correct answer for number 2 is letter C, ligaments. Because a sprain happens when you stretch or tear one of your ligaments. Ligaments are bands of tissue that connect bones to each other. Sprains typically happen to ankles, knees, or wrists that are twisted or torn the wrong way. Signs of sprain include pain, bruising, swelling, instability, and joint stiffness. Again, the answer for number 2 is letter C, ligaments.
Now, for number 3, cramps typically occurs while you're exercising, but some cramps can be a result from. The answer for this is letter B, overuse of muscles, because muscle cramps have several causes. Some cramps result from overuse of your muscles. The simplest way to prevent muscle cramps are to avoid or limit the exercises that strain your muscles and cause cramps. Again, the answer for number 3 is letter B, overuse of muscles.
How about for number 4, where fractures do usually happen? The answer for this is letter D, bone. Because a fracture is a break usually in a bone. If the broken bone punctures the skin, it is called an open or compound fracture. An X-ray can tell if your bone is broken. You may need to wear a cast or splint. Sometimes you need surgery to put in plates, pins, or screws to keep the bone in place. Again, the answer for number 4 is letter D, bone.
Last item, number 5. If you experience muscle strain, you usually have a damage in. The answer for this is letter D, muscle and its attaching tendons. Because muscle strain, muscle pull, or even a muscle tear refers to damage to a muscle or its attaching tendons. Symptoms of muscle strain include swelling, bruising, or redness due to its injury, a pain even at rest, a pain with the specific muscle or the joints in relation to the muscle is used, weakness of the muscles or tendons, and inability to use the muscle at all. Again, the answer for number 5 is letter D, muscles and its attaching tendons.
So how was it, dear learners? Did you get a perfect score? If you did, excellent. But if you got 3 correct answers and below, don't worry because we will still have another activity. Just do your best for the next activity.
For today's final activity, read the direction carefully on the worksheet provided by your implementer. Again, for today's final activity, read the direction carefully on the worksheet provided by your implementer. For those learners who have not been given a worksheet yet, we will read the statement twice and listen carefully.
Identify the injury mentioned and solve the crossword puzzle using the clues below. Write your answers on learner's activity sheet or on a sheet of paper. Again, that. Identify the injury mentioned and solve the crossword puzzle using the clues below. Write your answers on your learner's activity sheet or on a sheet of paper.
Across, 1 is twisting of ligaments at joint. 3, injury to a muscle or a tendon. 4, disease in which your bones become weak. Then for down, 2, break in bones due to injury. For 5, suddenly tightens up. Again, for the across, 1, twisting of ligaments at joint. 3, injury to a muscle or a tendon. 4, disease in which your bones become weak. And for the down, 2, break in bones due to injury. And 5, suddenly tightens up, connected directly and which indirectly.
So did you get it? Very good. To our beloved learners, you can continue answering your activity after this episode. You can pass your activity sheets to your implementers for the next session.
That's all for today's discussion, our beloved Als learners. But before we end our session for today, we will announce first who will receive the 50 pesos worth of load. Do we have a winner now, Sir Ben?
Yes, Sir Ike. And our winner for today's Tanong Ko Sagot Mo is no other than Dave Batak from Biliran. And his answer is the injuries and diseases that can harm the skeletal and muscular system are sprain, cramps, strain, osteoporosis, and fractures. Again, congratulations to Dave Batak. You get the correct answer.
Those unlucky winners, don't worry because our Tanong Ko Sagot Mo will continue in the next episode of Als Radyo Eskwela. Please tune in again to 103.9 Radyo Natin FM on January 18, 2021. Still at the same times, 11:30 in the morning for another exciting and insightful discussion.
So to our beloved learners, if you have any questions or clarifications, don't be shy. Feel free to text, call, or chat your ALS implementers for more information.
This is Teacher Ike, which leaves you a message. Healthy muscles, bones, and joints are important to a fit and active lifestyle, a safe and secure working life. To protect these from injury and illness such as back pain or repetitive strain symptoms, you could adopt safe working practices, understand risk and responsibilities, spot patterns or trends in workplace incidents, accidents, or absence.
And this is Teacher Ruben saying we must listen to our own body, otherwise injury and illness will ensure. Proper nutrition, right amount of clean, drinking water, exercise, and enough sleep and rest are ways to make the bones, muscles, and the whole body healthy.
Thank you so much for listening, and I hope you're learning with great things that can help you in your life every day. Until next time, stay safe, God bless, and once again, good morning.
If you enjoyed this episode, be sure to subscribe so you're notified when the new episodes is posted. Share this lesson with your friends. Have a great day, everyone. Again, this is Biliran Als Radyo Eskwela.
Dibisyon ng Biliran Alternative Learning System kasama ang buong kagawaran ng edukasyon at